So lovely to see you all. It's actually been 2 weeks since I last saw you all, which is bizarre, I know. I can't quite believe it. It's gone so quick, but it was which was amazing. And I was hoping to go on live with you, but I was so busy. I just didn't have time. I was stupidly wearing heels, and I probably shouldn't have been wearing heels at all. But yeah, I was on I was in heels for about 6 hours. So sorry about not having you live last week. Laura,
Hello.
lovely Dr. Laura has just joined us.
Hi
So
there.
I can hear you. Are you
Yeah,
okay?
I'm good. Thank you.
You
I
look
just,
lovely.
oh, thanks. So do you.
It
Such
must
a
have been
glowy
your
skin.
lovely holiday.
Yeah, I have a little bit of a yellowish tan now.
You still
Normally I'm,
look beautiful. I'm very jealous.
normally I'm as pale as paper, so it's very unusual.
Well, what we'll do is before we start going into what we're discussing today, which is the art of facial balancing, um, my name's Dr. Victoria, for anybody that doesn't know. I'm a medical doctor with 10 years experience in the NHS. My NHS job is an ears, nose and throat doctor, but I have a special interest in facial aesthetics and I run a company in Leeds. And then I'll just let Laura introduce herself.
Hi, so my name is Dr. Laura. I'm a dentist by background, so I've been practicing aesthetics for the past 6 years. I teach at the Harry Academy where I've met Victoria, and I also work at Story Clinic, and I recently opened up my own, so this is me.
Lovely. Gosh, well, you're very experienced, as I always tell you, and I always harass you for questions and advice. So thank you so much for joining us today. The aim today was to discuss the art of facial balancing, which I think some people might already have an idea of what it is, but not necessarily what it entails. Do you
I do
agree?
agree. I actually think that people started focusing towards this topic when they started seeing this thing being advertised on social media and not really understanding what actually is behind it. So, with that, personally, what I feel in my students and my patients, I feel like they are referring to it as to having certain type of chin, certain type of cheeks, a certain type of looks. Um, However, I'm not entirely sure if I agree with that, because even though there is that golden ratio, I feel like and I treat my patients and I feel like my patients are like a masterpiece, and I only touch their face if I feel like it's absolutely necessary, or it would benefit them rather than change their faces into certain shape that would be that balanced face look.
Yeah, absolutely. I 100% agree. I think it's had a lot of attention on social media, and before it was called a profile plasty as well. But actually, if you're a medical professional, it's something that's ingrained in you to do that because you understand the anatomy. You never want to make anybody look like they've had something
Done.
done. And you want them to look like themselves. You don't want them to look like they've just come off a manufacturing kind of conveyor belt and they've all got the same lips, the same
Exactly.
cheeks. Um, because I would love to have certain people's lips, but I know that if you plastered that onto my face, it wouldn't suit me. It would
Or
look
it would
completely
change
bizarre.
you. It would also change you. And you then wouldn't be you without your lips or without your eyes or without your nose. So when you even think about, for example, let's say Lady Gaga, okay? So if you do the rhino on her, she wouldn't be her anymore. So that's why I sometimes, most of times actually, I say no to certain things to my patients, and I also tend to teach that to my students as well, because I believe this is super important. It's so easy to do that, you know, 5-point non-surgical facelift technique, you know, so you know, now 2 centimeters down, 1 centimeter in here, and then that's the point we inject. But you need to respect the fact that everyone's face is different. Everyone's face is shaped in a different way. It's different width, so you have to understand that as well. So you don't just measure everything with like centimeters here and there. You also have to understand where is that bony margin, where are you aiming to inject actually, and what are you trying to achieve with your injection. So that's why I believe it's really important for us as practitioners to educate our patients that even though they come in and say like, I want 5-point facelift, it might not be the same look as they've seen on Instagram, or they might not get the same results as well. Because, for example, if you have one patient, you need 5 mils, you have another patient, you need 10 mils to achieve the same results. So it's not always as simple.
Yeah, absolutely. And I think it's about having realistic expectations and addressing the underlying anatomy that's causing that change, that's making that person self-conscious. So,
Exactly.
for example, deepening of the nasolabial folds, which for some people that don't know, it's these lines here, or the marionette lines here. Now, if you go to someone and you say, yeah, I'm booked in, I want this fixed, they're expecting filler, and they're expecting filler directly there.
Yeah.
But actually, if you understand the underlying anatomy and you know what's happening as the face ages, the fat loss changes, then actually, if you put filler in that area, you could actually make the situation worse.
Definitely. It may even look heavier here, as I sometimes describe. It's going to be like a Homer Simpson or chipmunk look. So it's always important to understand that we start to age and lose support from the upper face, temples, lateral aspect of the face, and mid-face first. So once we address all of these areas, then we are able to target any other areas in the lower face, like perioral region. So that is why that, you know, facial balancing is there. So you have to balance the face, starting from the areas that need to be addressed first. So it differs person to person.
Absolutely. And I think that's part of the art of facial balancing, is understanding what's actually happening underneath that skin and being able to educate the patient as to why something that they've initially been focused on, rather than just tracking one line, actually you need to take a step back and have a look at the entire face. And that doesn't mean being completely symmetrical. Nobody is symmetrical.
Sure.
So there's no point trying to chase that, because it's not realistic. It's about balancing the facial features, replacing any loss that's occurred over time, and making someone feel more confident in their own body and in their own appearance.
Yes, I completely agree with this statement. I have nothing else to add. Just because,
Laura.
yeah, I feel like you think the same way as I do, and that's why we understand each other so well. Yes, I completely agree. I completely agree. And we definitely don't want to make everyone look the same. And that's the problem nowadays, actually, that everyone actually looks the same. Especially when you look in their chins, lips. Chin is one of those areas. You can either go very well with it, or it can go so wrong that you might look like you have a witch's chin, okay? So it's nice to have a nice feminine shaped chin if you're treating a female, for example. But overdoing it can result in very, very bad aesthetic results. So we have facial thirds. So we have 1/3, 2/3, and the third third. So basically, we definitely don't want to make this one longer than any other thirds in your face, because that doesn't benefit the face. Even though it's going to pull your chin down, you might not see the jowls so much, but it doesn't suit everyone. I received a question actually from one of my followers regarding the chin. So how do I treat chin? What techniques do I use? What filler do I choose to use? Again, I could...
Oh,
Most times.
Laura, I think we've lost you for a second.
Might be my mic.
Back?
I'm not sure. Mic?
You're back now. You're back now.
So it could be my mic. Actually, I'm using it. I recommend to use it for you as well, just because it removes the background noise I have from the neighbors. Yeah. So in regards to the chin, what I wanted to say, it's definitely that I can't tell I'm using this specific technique to every single one of my patients. However, most of times I tend to use cannula, which can be a little bit uncomfortable. So I'm not sure, most people probably don't know what cannula is. So cannula is essentially a blunt tube covered most times with silicone. The one I use is covered with silicone, so it would glide through the tissue nicely without actually creating too much damage there. So with the cannula, we are able to introduce the product in a safer manner. So we do have underlying vascularity, especially in this area, that not everybody has, but some people may have, and we can definitely create problems if we're treating patients with needle in the mid area of the chin. So that is why I prefer cannula, to increase the safety profile with my patients. However, I can certainly say that it's not always possible to achieve the same result with cannula as with needle, especially when we want to project. So that would be my answer. Sometimes I need to use both. Sometimes I tend to use cannula. It's just the patient selection, and when you have a patient in front of you, you are able to tell. Especially when the patient is messaging saying like, oh, Laura, is it going to be with cannula or with needle? I can't really say until I see you in person. So I'm not sure how, whether you already received any messages as such, but it's really, really difficult. And especially when people ask, oh, what technique you're going to use for my lips, or what you're going to do with me. I can't tell until I see you in person, okay? So that's why those consultations are essential. And I know you have an hour-long consultations in your clinic as well, which is, I believe, is great, because that's what I do as well. Now, I probably take a little bit less than an hour, but if it's like my first timer, the patient that comes to see me for a first time, I definitely take my time. I believe it's much more essential than actually injecting. And long-term patients start to actually respect that, and they value that, because most places don't really offer that much of attention. They over-focus on in and out injections, and they're like, oh, but no one told me that, no one told me this. But we as practitioners, as medical professionals, we definitely have to cover everything, and we have to make sure that our patients are safe.
Yeah, absolutely. And it's very similar in my clinic. I have found people saying, how much for 1 ml of dermal filler? Are you going to do a needle or a cannula? I've got lines here. Can you put filler in? And yes, I can. I can put filler anywhere if I need to, but should I is the actual question. And that's where that 1 hour consultation, I can't tell whether I'm going to use a needle or a cannula. I can't tell what area I'm going to look at. And interestingly, the same with lip filler and chin filler. It's very good having photographs on Instagram saying, look at this, but your face is not a 2D structure. So actually, we're always looking from different angles and checking what kind of dimensions we need to be looking at. Because actually, if you just do a one-size-fits-all system for people, they won't get a result that they're truly happy with. And that's what the aim is, after all.
Definitely, definitely agree. So, and in regards of the fillers, so for example, if your patient would say, "Oh, Victoria, can I have Revelax filler in my chin? Do you work with that?" What would be your answer?
No.
Same. I often get asked that a lot. It's just my choice because I've seen problems with that particular filler in my patients. Nodules, lumps, bumps, difficulty to get rid of the old filler. Personally, I don't judge people that do. I do believe that Revelax gives a good projection and creates really, really nice structure. However, I just personally choose to treat patients with filler that looks slightly more delicate in the face, and it is easier for it to be removed in case if something goes wrong. That's my aim predominantly, just because I believe I want my patients to be safe. I don't want them to have something in their face that can't be removed anymore, you know. Of course, that can
Absolutely.
happen with any brand of fillers, but that safety profile really matters to me, and I believe should matter to every medical professional.
Yeah. There's a range of different dermal fillers out there, and it can get quite
Mm.
confusing for the patient because if someone that they're following on social media says, "Oh, I want that because so and so had it," that
Mm-hmm.
doesn't necessarily mean that it's a good product. And I'm very fearful of putting anything on my Instagram where I show before and after results, because what I don't want is people coming in and saying, "You did this man or woman's filler, this is the exact look I want." It's
Mm-hmm.
not like coming in for a haircut. it's
No.
it's completely different. And the range of different dermal fillers that are available, you should be using different types of dermal fillers to address different problems and different layers. So if you end up using a filler that you would commonly use in the cheek and you put it in the lips, you are going to end up with an unrealistic, unnatural result. And that's not how I work. And that's where facial balancing comes in. It's understanding all of these different things, having a holistic approach, and working with the person themselves over that hour consult to say, what are you looking for? And is that realistic?
Definitely. And again, one more thing, like if I use one filler brand for lips, I'm not necessarily I'm going to be using the same brand filler for cheeks, for example, just because one brand can achieve certain projection in one area, and for lips I aim for something very different. So personally, I'm not the doctor that sticks
No.
to one brand exclusively. So that's why it's also quite good because patients can find more variety in my clinic. However, sometimes having that variety is also not a great thing. So one tip I would give to all of the followers or all of the people that are going to watch this is if you had the previous filler in the same area earlier than 6 months ago, which was different brand than you're going to try now, just wait until it's been 6 months. So you don't want any two different fillers in the same place too soon, because that can be a problem later on. That can develop lumps and bumps that you can't get rid of.
Yeah, absolutely. And it's finding the medical professional that is happy to tell you no as well.
Yeah, we patients hear too much no nowadays.
But you
Yes.
have to be. You can't work with people. It's the same as when I go see my hairdresser, for example. I might show her something and she goes, "Victoria, that is not going to work on your face. That's not going to be flattering." No. Or if you've had a bad day and you turn up to have lip filler, for example, because you've broken up with somebody or you've had a really horrible row with your partner, then is not the time to be making decisions.
I agree with you completely, because then you might think like, no, I want bigger, I want bigger, I want bigger.
Yeah.
And then couple weeks in, you're going to look at yourself and think like, is that even me? So I completely agree. Don't act on emotions. And even though someone, for example, if someone is going to say, oh, you need cheeks, or you need jawline, or you need chin, don't listen to them. Was it your concern to start with? If it wasn't, then forget about it. Okay, so just ask for few different opinions from a few different doctors. Do I need it? Instead of coming to the doctor and asking for it. Because if one person thinks that you need it, doesn't necessarily mean that you actually need it. So that,
Absolutely.
yeah.
And instead of having the thought of asking for how many meals, what technique, what you should be asking is, this is the area that I'm worried about. How is best to address this? And allowing that professional to go through that with you and say, this is the best option, or these are the range of options, and these are the risks and benefits of each.
Definitely. Rather than deciding yourself, because it's a separate area of science that actually you have to learn, and you learn over time. It's not that easy. It's not that simple as it looks to start with. So definitely, if you trust your practitioner, just ask their opinion. Tell them your concerns. We are always able to help. We are always able to address your concerns, as long as you are open with us in regards to what concerns you have. Not like, oh, I want this line gone and I want this filled here.
Yeah, absolutely. And another point with the facial balancing, or profiloplasty, if you want to call it that, is the differences in cultural beliefs with regards to beauty. Have you had any concerns with having to address cultural differences when looking at facial balancing?
Yeah, I haven't had that personally. Usually my patients are very, very nice people that trust me and ask for advice, and they trust me completely. So I haven't had difficulties personally, but yes, if we have more of an Asian type patient, we certainly don't want to project their zygomas. So here, just because it's going to widen their face even more, it's not going to suit their face at all. So we definitely, when you have a different culture, different background patients, you need to understand how to address their faces as well. So it is not easy. But it is definitely something important, because we can't really choose that 5-point approach where we just inject according to the marks that we're taught. So yeah, it's not going to fit everyone. So African Americans, or for example Asians, and you take someone from Europe, or then another person from Spain, and you have completely different shape faces, completely different structures. Some people may have high cheekbones, some people might not. Then also you might think of, even when talking about anti-wrinkle procedures, we also need to take this into account. It's not just for fillers. So it's super, super important to understand the anatomy and what and where we need to inject.
Yeah, absolutely. I think with facial balancing and the golden ratios and the way we look at the face, you still have to take into account different ethnicities, because that ratio is not made for every ethnicity. So you always have to take that into account as well.
That's why I love this job. It's like creating art every day. It's super challenging, but it's also very stimulating. So I love it.
It's definitely creative. Definitely thinking outside the box and trying to get the best result for the patient. Absolutely.
Yeah, like if it's every medical profession, I believe.
So did you get any other questions at all, or should we open it up to the rest of the people on today, whether they have any specific questions that they'd like us to answer? Laura, you are an amazing specialist. We know, I know.
Oh, thanks. That's too kind.
I harass her all the time online.
Imagine
Any
the
other
number.
questions? Any other questions at all? Otherwise, is there any that you've had personally at all that you want to cover today, Laura?
Yeah, so I actually had a question as well from one of the girls, top 3 tips for aging skin. But instead of answering myself, I want to ask you.
Oh, put me on the spot, why don't you?
What would you say?
Well, my top tip for aging skin is prevention first. So if you're not developing aging yet, but you're thinking about how to prevent it, I would say good skincare. Ideally, a medical grade skincare if you can, or if not, a high quality high street alternative, which you can speak with either Laura or myself about on consultation. Every single person I see in my consults ends up, whether they like it or not, a full premium medical grade skincare routine, but also a high street alternative, so that they can always address that early. As you age, obviously my next tip would be, if you haven't started a skincare routine, start it now, because you can still continue to age and have problems with your skin and texture and elasticity. The answer to aging skin isn't always dermal fillers and Botox, and not everybody is keen to have injections in their face. So my third tip would be to, when you see the professional, also talk about other skincare treatments, such as rejuvenation, resurfacing treatments, such as chemical peels, microneedling, Profilo, or polynucleotides. I've started using polynucleotides. Well, I will be starting polynucleotides from March, but I have been using them here and there. And the results are fantastic. But you have to, it's not just sticking to one thing and that's it. Oh, I'm aging, I'm going to have filler. It's incorporating all of those different things to provide a holistic approach and enhance the results.
Definitely, and also probably including the devices as well. If the person doesn't want to get any injectables, you can certainly so introduce device-based treatments, such as microneedling with radio frequency, or HIFU, or the light-based treatments, lasers. There are a million things that we can do nowadays to prevent our skin from aging. And it doesn't necessarily have to be injectables. It doesn't necessarily have to be something foreign or something that you don't have in your skin. There are different modalities that we can recommend. So if you're scared to have any injectable procedures, any I don't know, mesotherapy solutions, because you think, oh, what if I will get an allergic reaction, or if you don't want to have any sinister in your body like fillers, we have options. Even we can sometimes create fillers from our blood, so it doesn't have to be something foreign. So just be open and ask away. There is a question, I missed the first bit, so sorry if you covered this, but how is facial balancing done? What's the process?
Well, Laura, as you put me on the spot, which I passed, it's your turn.
Yeah. So how is facial balancing done? So facial balancing essentially is a procedure to address the aging of the face and address certain areas to balance the face a little bit more. Typically we use dermal fillers that could be either hyaluronic acid based, or it could be something like calcium hydroxyapatite, which I tend to use in my clinic as well, which is considered to be more of a permanent type of filler, or you can use it as a stimulatory product. However, when you want to balance the face, I don't look to just the injectable procedures. As Victoria also mentioned, I definitely combine different treatment modalities out there to achieve best results, because if you just are going to inject dermal filler and you have active acne, or you have rosacea, or it's not active now but it becomes active time to time, it's never going to look as great as if you manage the skin problems and then you introduce the injectables. But essentially facial balancing is about injecting certain products in the face, which is like a dermal filler, to balance out the features a little bit more. Sometimes this can be done to the way it changes your features, and sometimes it can be done to the extent where we enhance your own beautiful features. So essentially it's just the dermal filler treatments to address these areas of concern and address the aging. Now, how is it done? It's done by needles and cannulas, and it's just basically injectable fillers all across the face. It sounds terrible.
It does sound
but actually,
terrible when you put it that way.
Yeah, it does sound terrible, but actually it's not that terrible. It's not that painful. Products do contain lidocaine, so you're all numbed up. We can always numb you even more. It's not that terrible, believe me. I had some patients that started sleeping and snoring during the procedure.
I think the take-home message from facial balancing is don't be scared of it. It's a minimalistic, holistic approach to addressing the face as a whole. And it's a way of addressing your concerns, but maintaining your own beauty and individuality.
Yeah, that's what we do.
That's what we do. Now, I know some of you have been joining in a little bit late. Is there any other questions at all that people want us to address? Don't worry if you have missed it. I will upload this as a reel, and it will be with Dr. Laura as a collaboration. We've also, well, Laura's been on it for a while, but I've now joined YouTube. So it will also be available on YouTube. I know, I think I'm on every platform now apart from TikTok.
I'm going to
I'm trying to avoid TikTok.
I didn't join the YouTube. My boyfriend put me on there.
No, I did it myself. And I came upstairs and my husband went, what have you been up to? I was like, oh, nothing. I've just, you know, I'm now a YouTuber. And he just looked at me like, what? You what?
Yeah, we are just switching the career a little bit.
Yeah. Lorna seems much happier now that we've explained that it doesn't sound as bad as she initially thought. So that's good. Well done, Laura. You put her at ease. Well, if that's everything, thank you so much, Laura.
My pleasure.
Hopefully this isn't the first and last time you come on to have a chat with me.
No, I think we'll have many more of those.
You're not scarred from speaking to me on a regular basis.
I am not. We're speaking on a daily basis, I think.
I know we are.
Hi, can we connect?
So much. It's been an absolute pleasure, as per usual. It's lovely speaking to someone that's on the same page as you and understands each other's business as well. It's fantastic, and you have so much knowledge, and it's just brilliant, as always, to pick your brains.
Happy to share.
Well, that's it for now. Thank you so much, everybody. Thank you, Laura.
See you around.
And have an amazing weekend.
Too.
Bye.
Bye.
Thank you. Bye.